My name is Dara and I'm the broker owner of Realty One Group Advantage. I have all kinds of hobbies. I play racquetball. I'm starting to play pickleball. I love to play backgammon, and I'm a magician. At the beginning of 2017, I was getting into bed very gently. I didn't jump, I didn't twist myself. I just got into bed, and as soon as I laid down, I felt this piercing pain in my right hip. When that pain started in my hip, and I got up, it was pretty much confined to my hip. But through the weeks, through the months, it started radiating down the right side of my right leg. It went eventually all the way and was almost grabbing my heel and pulling it up. I couldn't sit in a car for more than 20 minutes. The pain would just be too bad. The best experience I had was when I was standing. So I was on my feet whenever I could be. If there was a meeting and we were talking business, I would be walking around the table because it didn't hurt when I walked. But as soon as I sat down, as soon as I laid down, the pain would come back. It was very difficult to sleep. It was not fun. I couldn't play racquetball. I couldn't do any of the things that I enjoyed doing.
Dara's doctor prescribes step therapy, which is a series of conservative treatments, including massages, pain medications, and physical therapy. Nearly a year passed as he continued struggling with no relief from pain, and that was making him desperate.
Really, it was the heating pad that gave me a little bit of relief. Cold didn't seem to give me very much relief. Stretching, the physical therapists told me to stretch. So I did all the laying down on your ground, bend your knees up and rocking side to side, pulling your knee from right to left and left to right. Whatever I did, still the pain was there. Once the pain started at the beginning of 2017, we tried the physical therapy, we tried massage therapy, structural energy therapy. We tried everything. And by the end of 2017, I was practically giving up. I never had any thoughts of suicide or anything like that, never in my life. But it kind of made me wish that I might prefer that alternative than living with that pain. That went on for almost a year.
At the urging of a friend, Dara made an appointment with the Bonati Spine Institute for an evaluation with Dr. Bonati.
Well, I arrived at the Institute. They greeted me warmly. It wasn't more than 20 minutes that I was seeing Dr. Bonati. He scheduled the MRI at the Institute. It was a separate building. So we went over to the other building. I was with my wife. I had the second set of MRIs done. Within about 20 minutes, I was seeing Dr. Bonati again, and he was showing me visually where I was having problems on my back. Dr. Bonati asked me where I was feeling pain, and I described it in the hip and going down the legs, and then he showed me how the area where the pain was going was relating to the images in the MRI. The consultation with Dr. Bonati made me feel very confident that I was in the right place. The reputation of Dr. Bonati made me feel confident that I was in the right place. And the treatment by the staff was just wonderful.
The exclusive Bonati Spine procedures are performed incrementally using conscious IV sedation. While in a twilight state, patients are encouraged to communicate with their surgeon to ensure the source of their pain is eliminated. Due to the patented tools and techniques used in the Bonati Spine procedures, only a small incision, roughly the width of a thumbnail, is required. This drastically reduces the risk of infection and allows for a quicker recovery time.
Well, it was explained to me what the process was going to be, and interestingly, there was a monitor down as I was laying on my stomach. There was a monitor on the floor or somewhere below me that I was looking at, but just in front of that monitor, my wife was sitting there and watching the process also. It was explained to me ahead of time, but it was still kind of interesting when you're there. And within 2 hours after the surgery, I got up on my own 2 feet, no crutches, nothing. I walked out to my car and my wife took me home. It was pretty quick and very interesting and very effective.
Patients are often surprised at how quickly they can return to their daily routine after receiving the targeted Bonati spine procedures without the need for uncomfortable braces or suffering through weeks of physical therapy. After leaving the Bonati Spine Institute, patients are told to walk a few times a day to aid their body in the healing process.
I think Dr. Bonati told me back then not to go to work for 2 days. My work is not strenuous. I'm a real estate broker. My agents come to me for my help, so I'm not even going out and showing houses. So it was an easy go back to work experience for me. I was pretty much normal. Yeah, I was able to sit in the car, drive, without worrying about the pain kicking in. I was on the racquetball courts as soon as I could get there.
Dara happily recommends anyone struggling with neck or back pain to contact the Bonati Spine Institute.
I kind of look at him as the savior, and not only would I refer other people to him, but I have.
It's been years since his Bonati spine procedures, and Dara is still working every day and playing racquetball regularly, all pain-free.
Now there's no limitation as to what I do. I do everything. Fully active. I don't have any more back pain.
To see more stories of recovery just like this, search for the Bonati Spine Institute on YouTube, Rumble, Roku, Amazon's Fire TV, Google Play Store, and Apple's App Store.